everyone. A very warm welcome to another exciting episode of Psychology Talks. And I'm very excited to actually talk about loving system or a heart or the leadership actually led through heart. So is this like our guest is expert in healthcare, but his work actually uh, can be applicable to all fields. So he's the co-founder of Loving Organization, and he's developing an innovative soap framework. He is a physician, clinician, and system thinker who is pioneering transformative change in healthcare organization. So let's welcome Dr. Apurv Gupta. Thank you so much for joining. It's really an honor to have you with us today.
My pleasure. Thank you for having me here, Ambreen. What an exciting opportunity this is.
Thank you so much. I was looking forward to our conversation. And before I actually forget, I actually want to tell our audience that we are also collaborating an event healthcare summit that is scheduled on September 6th. So those who have still not registered, please register now. There's like a link in the comment, and please. So anyways, let's begin our show. I actually gave a very brief introduction about you, but tell us a bit more about you. That what do you do, and how you end up in this field, in this career.
Yes, thank you. And how I end up here talking to you in front of this incredible
Yes.
audience. It's so fortuitous to have just met you in just a few short months. I feel we've already established a really great colleagueship and friendship and just a deeper understanding of the kind of change we're trying to bring about in this world. And so it's really amazing to collaborate with you. Thanks for plugging our healthcare summit on September 6th. It's been amazing to work with you and Valerie on that. I'm really excited about that forum, which will bring a new perspective to our audience in terms of thinking about how everyone can get engaged in helping to address health systems related issues. So appreciate all of that, Umbreen. In terms of your question, well, I'm an internal medicine clinician. By background, I've worked in the healthcare provider field for a number of years in different roles as a hospitalist clinician and also hospitalist medical director. And then I became chief medical officer at a couple of different community hospitals, all in the US in the Boston region. And then about 12 years ago, I decided to kind of get into healthcare performance improvement consulting because I really wanted to focus my efforts on making systems work better. And that's been an incredible journey. Over the course of that time, I started realizing that in addition to performance improvement, which you can think of as just fixing more of the tactical, technical level issues that might come up, they might be disease based issues like congestive heart failure or diabetes. How do we improve the performance in those areas? Or they could be programs like the ICU or emergency room. What could be happening in those areas that might need more efficiency? So that's the world of performance improvement. And again, as I was just saying, over the course of the last decade, I started realizing that in addition to addressing things at the performance improvement level, we could make a more long lasting impact if we tried to address things at the culture level. So that's things like physician engagement. How do we get them involved in the work? How we make decisions, how we communicate, how we hold each other accountable. All of those things are really more part of the culture, and they cut across all the different things that we're trying to fix. So when we address things at that level, then we're actually making a deeper, more lasting impact. And so that's what I've been now working on over for a good part of the last decade. Over the course of COVID, Umbreen, kind of had a little bit of a pang of conscience, so to speak, thinking here I am fixing things or think I'm fixing things on the performance improvement side or the culture transformation side. Why is it then that so many of our colleagues are burning out? Nurses are burning out, doctors are burning out, and the numbers just keep increasing. So it made me really think, am I really making things better? Or what could be going on? And I started this inquiry a few years back into this process and actually realized that the answer was lay in a few organizations that we identified that were already doing something differently. They were, getting amazing results on quality, on safety, on patient experience, on burnout and turnover. of staff, and ultimately in profitability. And they were doing that by just taking better care of their own people at the organizational level and in a systems oriented way. They weren't necessarily working with each other. They were sort of each out there just doing their own thing. And when we chanced upon them, it struck us as, wow, this is love. This was what love feels like in an organizational setting. So a couple of years ago, we coined the terminology, a loving organization. And from there, it's been quite a ride, and a great momentum that we've been picking up as you and others have joined this movement. The goal of which is to really study these organizations that are already doing it a little bit more, bring to forth their methodologies, sort of reverse engineer some of the methodologies, and teach other people how they could do it. And really spread thought leadership and awareness around this whole movement that it's actually possible to lead with love and manage with love, operate with love. And when we do so, we're not sacrificing anything because we're actually delivering better results all around.
Wow, what an inspiring journey you had. I mean, you started as a clinician, as a physician, and then you came up like you had like several roles. So you had the experience of like from every aspect of your field, that you had been there as a like service provider, and then of course as a consultant. And now I think your focus is spreading love, which is actually quite generic, and but it's also quite misunderstood, because most of the time people don't understand what love is, and they take it in a very different way. So coming back to like your loving organization, I would just ask that what actually inspired you to actually spread love through this loving organization, and what kind of difficulties you face while you actually spread love spread in the professional setting.
Yes, thank you. Yes, thanks for clarifying that. And I'll just have to say it's a relatively recent journey for me and for all of us. So we're still learning very much in at the early stages of this. I like to say that we're at the innovation stages. We've identified 10 exemplar healthcare organizations in the U.S. There are probably more out there. We just haven't been able to identify them as yet. But that's still a relatively small number. And so we're at a very much an innovation stage in this journey. It's going to take a while. It may take years, may actually even take decades before the mainstream healthcare organizations and other industries like education and financial services, who are also kind of appropriate in needing this kind of transformation before they find out about it. So that's one thing, is for us to just be optimistic but cautious as well, and thoughtful in how we're rolling this out, and realistic with the realization that it may take time for this movement to roll out. Now I'll go back to something you just said in this question, which is that love is nothing really new. It's the oldest thing in the world. Love and fear comes alongside with it, and they've both been around for thousands of years. All of our wisdom teachers, our religious, spiritual teachers, and any political leaders, they've all talked about love at some point or the other. So really, we're just trying to build upon all the great work that these amazing leaders have done. And the thing you could say, so what's new? Well, I think what's new maybe are a few things. One is that in the healthcare industry itself, particularly in the U.S., but actually also worldwide, we're finding, such as with you, in the Middle East, we're finding this in India, in New Zealand, in Canada, and other parts of Europe also, that the industry is really going through a very challenging time, and that people are burning out almost everywhere, which is kind of staggering. It's not just a product of our American-centered, thought process, and the way in which we organize the care and pay for the care, which is sometimes what we like to believe. Unfortunately, people are burning out, throughout the world. So this has become widely recognized and unfortunately widely felt as a challenge. To the extent that people are now willing to do something about it. I'm seeing in our consulting work that we do, health system CEOs are actually staying up at night because they can't staff their clinics, they can't staff their hospitals, they can't find enough people to keep the doors open. And that's really making them concerned. If you can't keep the doors open, you can't make money, you can't stay in business, you can't serve your patients. So I think that that's one thing that seems to be really different over the last several decades that I've been in this industry, is that people are paying attention and they want to do something about this because they realize that it's hitting proportions that are not sustainable. The other thing that's new is that we have these 10 exemplars that are doing something differently, and they're proving that it's possible. And not only possible, it's actually long term more sustainable and leads to all the amazing things that we want to see from healthcare organizations: quality, safety, patient experience, and profitability. It can all get better. And then the third thing, the real twist to this that we're bringing, which you were saying in the interview early, in the sorry, the introduction earlier, is a systems-based approach. We really believe that it's not just about telling people to be more loving. It's very easy to kind of go back and say, hey, Dr. Smith, you're not loving enough. You need to be more loving. Nurse Mary, you need to be more empathetic or compassionate. So we're going to send you to compassion training. That's sort of almost reflexive. And it seems like the easy approach to say, hey, if we have a compassion or empathy deficit, it must be the people. So let's put the people through some training. But that's really not the case. And, yes, of course, training never really hurts. And it's a good thing to train people. And we can all learn how to be more loving. All of us can be on this loving journey and actually keep improving in how we become more loving. At the same time, our hypothesis is that it's the overall organization that's creating the milieu for being loving or not loving. People are inherently already loving, especially doctors, nurses, and other clinicians and leaders who have gone into healthcare. They've gone into it because it's a mission and it's a calling. They've gone into it with a sense of love and compassion. But then, unfortunately, over the course of medical school, nursing school, residency, fellowship, and just work, it's kind of gotten beaten out of us, all of us. This instinct and impulse to be loving. That's because of the organizational dynamics in which we work. So what we're trying to do is exhort the organizations to take their work to the next level, take responsibility for being loving, and to look at all the systems within which they have the opportunity to integrate love. And so, I'll pause here because I've probably said a lot, but I'd love to get into deeper into the conversation about what does it mean to look at the systems, and how do we integrate love into those systems.
Yes, I mean, your mission is so beautiful, actually, that, bringing back to the love and compassion to the system. And I think, as you said, that we are all like, we are born to love, actually, but throughout the journey of, like, it's not only with the doctors or nurses, or I think it's quite relatable to every person that who is maybe in their career. They actually forget there that, there is something more than this career and then, like, chasing money and chasing profitability. It's more of, like, remembering our own, like, the reason for existence is, I think, is to spread love and to remember that, okay, we are here to love, not to create more boundaries or to create some exhaustion. So actually, you already asked the next question, so tell us about more, like you said, what is it about? So uh,
Yes.
now please feel free to answer your own question.
Thank you. I like that. Yes, I'm setting the stage myself. That's awesome. Well, I want to build off of what you just said. I think that in a work environment, all of us are looking for something more out of work than just getting a salary. Yes, of course, we want to get paid, and that's an important part of what we're trying to do. But at the same time, work is a big part of our lives, and it brings meaning, purpose, joy into our lives. And if we don't find that, that's when the burnout starts. Right. And that's when we start chasing just the money, because maybe then the money seems to be the only thing that we can maximize. So why not? If I can get paid more and I'm not going to find meaning, purpose, or joy in my work anyway, so I might as well make as much money as I can. Unfortunately, it's only a few years of doing that. And we all realize that that's not going to lead to happiness. That's not going to lead to health. It's not going to lead to organizational success. So we start the journey for most organizations at that level of mission and vision and purpose. All healthcare organizations organizations, and many organizations already have some core of compassion or empathy or human centeredness, patient centeredness is already their mission. We don't need to call it love. We just need to call it whatever it already is in the organization's mission. We just want to bring it out and take it off the wall and start asking the leaders to say, hey, are we practicing this? Are we embodying this? How are we living this? If we're not living this, then how will our people feel this? And if they don't feel this, then there's no surprise that they're getting disengaged and burnt out and then disaffected and are willing to leave us for $5 more an hour. That's not what we want. That's not what they want. But that behooves the organization again, then the leaders to engage differently with their own culture and their own mission, vision, values. So for us, culture is one of the key systems of an organization. We've actually developed a model. We call it Integrate, which is a 9-letter acronym that stands for, each letter stands for one element of the systems that we'll find in an organization. And so there are 4 people-based systems that normally you would think, oh yeah, love. Of course, love has to come from the people. Yes, of course, that's correct. So that's the leadership, the teams, the staff themselves, and the community. That's the 4 people-based systems. And then we have 5 non-people-based systems. That's the culture, the mission, vision, values that we just talked about, technology, workflows, policies, and the management systems. So these 5 non-people based systems, when they come together with the people based systems, that helps us understand as leaders the kind of range of impact that we could have, that we can actually embed love in each of these systems in order to make our overall organization more loving. And what that does is then it takes the burden off the individuals themselves to try to be more loving. Of course, Dr. Smith and Nurse Mary still need to be loving as well. But imagine what would happen if we lifted up the floor for everybody and made it more easy for all of our staff to be able to operate in the way that they want to operate. No one wants to come into work, especially in a healthcare setting, not being loving. They just feel frustrated and unhappy when their work environment isn't conducive to that. So I really call attention to those 9 systems, and it's really that breakthrough that ultimately it's going to be about the systems and integrating love into the systems that will allow us to spread this, to scale this, and to sustain this. That's a little bit different than how we've been trying to bring love into society, heretofore.
Yes, that's amazing. I mean, listening to you actually give me some question that, like you just said that, you want to build a culture and it's like everyone, uh, just tries to be the best. And it's, as you said, that it's all, we are already there. Like we are meant to love each other. We are meant to be there. And it's also purpose calling, and it is like, I would say, it's more of like inherent also, that we are bound to do this, and we are bound to follow our callings, and we're bound to love each other. But there is something on the way goes wrong, right? So what do you think, especially in the healthcare system, um, what went wrong, that if we are all bound to do that, if we are inherent to do all these things, so what went wrong? What is causing the burnout?
I love it. I love that question. And it's probably something that I should have mentioned earlier. So I'm really glad you're calling me back to it. We're positing the fundamental issue as love versus fear. And that's actually one of the main reasons why we've chose this terminology of love. I think everybody understands what fear is. We've all experienced it. And unfortunately, we experience it in society. We experience it in our relationships. We experience it in our families, and we experience it at work. And it's to the point where we experience it and we don't even realize that that's what it is, because that's just sort of become the default. It's manifest in top down, patriarchal, hierarchical, command and control type mechanisms. And we just are used to managing each other that way. I'm going to tell you what to do. You're going to do it. If you don't do it, then I'll supervise you. I'll chastise you. I'll manage you. I'll censure you. All of these are really fear based ways of managing. That is just the way in which we're all trained. So what went wrong is sort of the origin of fear that's been side by side with love all along, ever since the origin days of no matter what philosophy we aspire to.
Yeah.
It's has really no beginning. So what we careful to point out is that it's not any individual's fault, or it's not any player's fault. We're not trying to blame the providers, or we're not trying to blame the payers. We're not trying to blame insurance companies or the regulators. It's not about pitting ourselves against each other. It's really about recognizing that we're all in this together. And unfortunately, we're all operating within systems that are inherently now fear based. The fear has gotten encrusted into those systems. And unless we recognize it and actively work on those systems to make them loving, we can't actually counteract the effects of the fear. Fear does spread very quickly. We all experience that as well. There's a lot of uncertainty, chaos, wars going on in the world, and that creates fear. So it spreads very quickly, and unfortunately, that can also wind up being just as rampant as love can be. The trick with love is that it really needs all of us to hold hands, to work together, to collaborate, and to actually realize that the love is there within each of us, but we can compound it by working together and amplify it even further by embedding it into the systems. So I just think love takes a little bit more work. Fear is a primal impulse, and it is a biological impulse, and so it's very easy for us to go into fear mode, fight or flight mode, when we're facing uncertainties in the world. It takes more effort, frankly, for each of us to recognize that the love is there too, and that there are just consistent, systematic ways for us to bring that love out. And if we build it into our organizations, then I'm hopeful that it will synergize more effectively.
Wow, yeah, that's you. You answered that question very profoundly, and I love that. So, like moving on to the other question, you actually talk about soap, like the soap framework, which actually I got to know only from you when we
Yes.
were doing the brainstorming session. So, how you can can you explain that what it is and how it can help to heal the system when we introduce the soap framework?
Yes, thank you, thank you. Yes, so switching gears just a little bit, this SOAP framework. SOAP is a mnemonic. It stands for subjective, objective, assessment, and plan, and it's a very simple, long-standing framework that all clinicians, really, pretty much around the world, have been trained in. And so we thought that that made a lot of sense for us to piggyback on that, because so many doctors, nurses, pharmacists, therapists, you name it, all kind of leverage that framework. That's how we communicate with each other in the clinical setting. Right. So when we see a patient, we write down the subjective. What is the patient feeling? Are they having chest pain? Are they having arm pain? Are they having dizziness? That's the subjective. The objective are, okay, what are their vital signs? What are their labs? What does their x-ray say? These are the tests that we do, and that we run on patients. So what are those showing? That's the objective. Then we put all of that together into the A part, which is the assessment. So what does this tell me? Based on the person's symptoms and based on the labs and the vital signs, what do I think is going on? Do I think they're having a heart attack? Or could it be gastroesophageal reflux? Or, did they just have a chest wall injury because they had fallen down last week? So that's the assessment. And then the P is the plan. So what am I planning to do based on my assessment? How do I want to go forward with treatment or potential additional diagnosis to rule out a heart attack, or to start to treat reflux, if that's what I think it is. So that's SOAP. And it just struck us, Amrit, again, as you were saying, you and I and Valerie were brainstorming this, and we thought, what could be a simple framework we could use to leverage to speak to the average clinicians that are out there, that are feeling the impact of the burnout for themselves or for their colleagues or for their loved ones, and they want to know, what can they do about this? They may not be administrators, they may not be organizational leaders, they may not feel like they can do something to change the overall systems. We said, well, yes, they can, because they're expert diagnosticians. Each and every one of them already knows how to think about a patient's condition and how to assess it, and then how to plan for it. So why don't we bring out this clinical paradigm that, again, is well known and ubiquitous throughout the world, and use that as a way to engage our doctors and nurses and therapists and pharmacists and other clinicians in thinking, well, how do I use a SOAP format to start to break down some systems based issues that I might be seeing around me, and come up with a plan that I can either embark upon or I can take to my leader or to my other fellow clinicians and see if we can try to start helping our clinicians rather than feeling frustrated and disenfranchised, that they can be part of the challenge in helping us heal the healthcare system. So that's the idea of the SOAP note and why we've integrated into our healthcare summit that's coming up on September 6th, where we're going to have about 15 people who are experts talking about how to use the SOAP note to become a more expert in diagnosing and healing the healthcare system.
Yeah, I think that's the fabulous way to actually tell leaders that how they can integrate the system, integrate this love and compassion through this. And but I would just also want to ask that, how do you plan to measure this, the impact of compassion and love in the healthcare system, that when they provide the patient outcome. So what exactly do you have any tools for that, or how do you measure that?
Yeah, yeah, and I'm tempted to answer this in a couple of different ways. One answer is like I just look at the exemplars, the 10 organizations we've already identified who are already doing this, and we look at what they've done. And really, what they've done is they're not measuring anything new. They're measuring the things that everybody's measuring, that every healthcare system and every clinician wants to improve, which is healthcare quality, healthcare safety, patient experience, turnover and burnout, and profitability. Right? These are the five key parameters that everyone's already trying to improve. Every health system, whether or not they're trying to be compassionate or not, is already trying to improve these. And so these exemplar loving organizations are just looking at these as the end results and trying to demonstrate that based on the way in which they're delivering the care and organizing their approach to the clinicians, that they're improving parameters across all of these five areas. So that's kind of like my immediate thought process is first, let's not really try to measure something new. Let's measure what we know we already need to measure. And let's try to demonstrate that because we can be more, have more love based management rather than fear based management and loving leadership, we can actually deliver better outcomes across the spectrum. So that's, I guess, answer number one. Answer number two is yes, but, or yes, and. In addition to that, there are definitely ways to measure compassion and love more actively, and many people have developed instruments. They're more subjective types of instruments, but we have are using those instruments. We can look at things like patient experience surveys, staff member engagement surveys, culture of safety surveys, and other metrics like good places to work types of certifications to understand what is the overall culture of the organization and the demeanor in which these services are being provided, and how are staff and patients receiving these services. So that's, I guess, a second answer. And then a third answer, which is kind of true to my nature as a consultant, is we've also developed around the integrate nine system model that I described to you. We've developed a maturity model that allows us to say, well, for each system, where is it on the scale of maturity from early stage to advanced? And this is based on our study of the exemplars and learning best practices. We've developed a five-stage maturity mechanism for each system. And so we can go into any health system and help them understand where they are on that maturity scale so they can identify their current strengths, they can identify their challenges, and they can develop a prioritized roadmap for how am I going to get from where I am currently to where I would like to get to. So that's a third way of measurement. It's more of an interview based and a subjective based measurement. But I think a combination of all of these, look at the things that we're already measuring and look to drive improvement in those. Supplement that with some carefully chosen surveys and subjective data. And then thirdly, undertake a maturity model assessment so you can understand where you're at, where you want to get to.
Yes, amazing. I love the way you explain from the different perspective, everything. So it's like, it shows that how much grip you have on the subject matter, that it's not just that you came across with this or you coined this term, just that everyone else is doing. You know that what you are doing and what where you want to go. So I'm really glad that you have all the knowledge and you're sharing it with all our audience. So thank you so much. I just want to also ask that you talk about this, that burnout is there. It's a massive issue in healthcare system, right? And you said that you want to introduce the loving system, which is going to solve the problems, right? How so in I want to ask that how do you foresee that how it's gonna provide the solution? What exactly, in what way you want to introduce the loving and compassionate environment? How do you actually plan to create a culture that promotes love and compassion?
Yeah, well, I think that's a great question, and hopefully it piggybacks off of my last answer, which is I think we start with understanding organization by organization. Maybe I guess that's my first answer to you. That's what we're trying to do. Each organization is you could say that's still going to take a long time to create scale, but we feel that an organization is at significant scale already because it represents thousands, tens of thousands, sometimes hundreds of thousands of people, and they're all coming together to work for a collective purpose. So, organization by organization is the first answer. That's how we want to work on this. The second answer goes back to my previous, the answer to the previous question, which is let's start with an understanding of where each organization is at with respect to the maturity of each of its systems. Some it may be doing really great at. Maybe the leadership system is already really well developed, but they haven't thought much about the policies or the workflows. So a maturity model assessment can help us there to understand where should we focus, where should we start. No one can work on everything. And there's probably no exemplar organization we've identified that is fantastic, 5 out of 5 on every single system. Each organization kind of has to pick the 3 or 4 systems that it's working on and try to improve the loving capacity of each of those systems. And it may not be every single one. This is a journey. Even loving organizations are also still on a journey. They will probably be ready to admit that even they have their failings. They may not be able to help every single patient in every single way that they want. They probably still have turnover that's too high compared to where they would like to be. So again, it's not about perfection, but it's about continuing on a journey. And I think a maturity model helps us on that journey. And I think that maturity model then helps us understand where to start. Should we start with training the leaders because the leaders are interested, but they haven't done some of the self-reflection, observation that's required. This is really a lot of inner work that needs to be done at the leadership level to say, am I a loving leader? Am I bringing my whole self to work? How am I collaborating with other people? Am I the role model that I want to be for other people? So that's some of the work that can be done in the leadership system. If we make it more tactical, let's say we look at the management system. Management is really the day-to-day things that need to happen in every single organization to make it function. A loving organization needs to have these things, but so will a non-loving organization have these things. That includes feedback, communication, decision making, accountability. All of these are management part of the management system. So we can assess each of these at an organization and understand how well developed is your feedback system, and is that feedback system loving or is it fear based? And if it is fear based, then how can we make it more loving? Can we have more ongoing regular feedback? Can we have it, instead of thinking about it as feedback, can we look at it as feed forward? Can we make it more 360 process so that more people are involved in the feedback process? So, like this, each and every element of the system can be broken down into its component parts and studied to help an organization understand where are they at and where would they like to go, and ultimately build on your strengths and choose a few things to focus on because nobody can do everything.
Yeah, yeah. I mean, that's really great. I mean, that's really great that you focus on this how to actually bring about the change in the management level, and to, it's not just taking the one aspect of the system. You're trying to take it as a holistically and try to address the problem in a more cohesive way. It's not like, just taking this one thing at a time and do it like so. It's really like I like the approach. Now I want to actually ask a question which I was it was coming to my mind that you talk about this bringing the change in the system. Now, if I take myself as like it's I'm not a clinician, but I'm rather the user of the services, right? That when we go to the healthcare or at like any clinic or something. So what do you think? What will people actually at the end or the end user will feel the difference from the organization that are on the like a loving organization or those who are not the loving organization. So would the end user will also be will get benefit, or it's just that the management will flourish, or there will be maybe some profitability come up. But what about the end user?
Yeah. Yeah, absolutely. It is about the end user, and I think that the real amazing insight that these loving organization exemplars have had is that in order to deliver end user impact to the patient and to their family, we really just need to first take care of our own people. When we take care of our own people, and those people find meaning and purpose and joy in their work, then they're more likely to be willing to collaborate with each other and do the work. That's what's going to lead to improvement in what I mentioned already: patient quality and patient safety, but also patient experience. That patient experience is how we really come to learn about how is the individual customer or patient experiencing the actual care that's being delivered. So it's a very key metric that already many healthcare organizations are tracking, and that metric is what our exemplars have shown us that improves once you actually start doing this work and go down the pathway of taking better care of your own people. Those people are there not for themselves. Those people in the loving journey for themselves are really there to take care of their patients. They're just not able to do it because no one's taking care of them, right? So many loving leaders that I've spoken to, they always start with this: we have to take care of the people who are taking care of the people. And when we do that and we put the investment in the people in a loving way, and not by expecting more out of the people themselves by saying, hey, you go get more training, or taking a deficit focused approach, like there's something missing in you, Dr. Smith or Nurse Mary. We take much more of a holistic approach of, well, let's fix the system so that each of our practitioners can operate the way they want to. When they do, they will deliver exceptional experience and the patients will feel it. That's one point I wanted to make. Another point I want to make is that out of the 9 systems, one of the systems is the people and the community. Okay, and so not only the people of the hospital or the clinic themselves, but the patients. So for us, the community, the patients, the families, and the other beneficiaries in the community are a critical system that also need to be taken into account. How are we designing our health system with their needs in mind? Are they sitting at the table? Some of our loving organization exemplars have completely redesigned their clinics based on what the community is looking for. They see the community as the key stakeholder and as the owner of the enterprise, which is really amazing to think about. So that's kind of where another place where people, the patients and their families and loved ones come in, is to make sure that their voices are being heard at the time that these systems are being designed and redesigned. Patient family advisory councils that some of our charter members advocate for and are experts in. But there are many numerous ways to make sure that patients and families are included. And of course, again, the main point being that when we do this work and do it the right way, patient experience and patient outcomes are clearly important parameters that we're looking at.
Yeah, I think there was a little internet issues. Uh,
Did I
yes,
lose you at some point,
yeah, I
Breen?
think can you? Yeah,
I can hear you.
yeah, I think
Yes.
yeah, I think you froze or maybe okay, that's great. So, anyways, I know we can go on, and I think that's the main matter that we want to discuss, and we want to bring it to the attention to the lot of people that during our healthcare summit. So, I know this topic is very interesting, and it's going to benefit to a lot of people, not only as I said, like not only to clinician or some and to the healthcare service provider, but also to the end user as well. So I think those who want to know more about it, please attend, register to this healthcare summit, which is planned on September 6th. And the link is in the comments. And please attend all our session and you will gain more insights on that. So I think with that I would like to end our show, but of course this conversation will keep continue during the summit. But before I actually finish the show, I would ask that what one piece of advice would you like to give to our healthcare uh, leaders to actually bring back the compassion and love to the system?
Yeah, I think my one piece of advice is it's doable. Don't be daunted. Other people are already doing it. And it's really the only sustainable way going forward. We've tried all sorts of other things over decades. They work for some time and then they stop working. This is the time to really put humanity back into our healthcare and to do it in a way that's going to make it durable, long lasting, and actually create even more profound impact than what we've been able to see so far.
Yeah, I think that's a wonderful advice. And lastly, please tell our audience that how they can find you. What is the best way to actually reach out to you?
Actually, I'd love to communicate with the audience. I'm seeing a number of comments coming in, and
Yeah,
I'm so grateful that people are paying attention and listening and finding it helpful. LinkedIn is a great way to connect with me. It's Dr. Apurv Gupta on LinkedIn, and so
yeah,
please connect with me there. Ambreen has got this www.alovingorganization.com scrolling at the bottom. That's a
yeah.
great way to come and contact our organization and learn more about us. My email and contacts are on my LinkedIn. I really encourage all of you who are motivated to reach out. Let's talk and let's think about what you're doing and how you think about this model and how each of you might be able to join us in the consortium journey and help to guide this process, for your clients and for your loved ones.
Yeah, that's amazing. Thank you so much, and thanks to all of the audience who joined in during the live conversation, and those who are actually even watching it as a replay. Thanks for watching and thanks for listening to us. And thank you so much, and have a great day. See you at the
Awesome.
summit.
Thank you so much, Ambreen.
Yeah.
This was such a pleasure. Thank you.